Gentlemen, today we're going to have an open conversation about something many men, particularly those over 60, rarely feel comfortable discussing: masturbation. Even saying the word can make some men uncomfortable because this subject has been surrounded by embarrassment, jokes, and misinformation for generations. But masturbation is a normal part of human sexuality, and getting older doesn't automatically mean that part of your life has to disappear. I'm Dr. Leah, and there's something important I want every older man to understand. Your body at 60 or 70 doesn't necessarily respond exactly as it did at 25. Your skin can become more delicate, sensitivity may change, erections may take longer to develop, and certain techniques you've used for decades may no longer feel as comfortable. That's why today's conversation isn't simply about pleasure. It's about protecting sensitive tissue, maintaining comfort, and supporting your sexual well-being as your body changes with age. I'm going to explain the 3 biggest masturbation mistakes men over 60 should avoid, along with safer alternatives that can make self-pleasure more comfortable and sustainable. And there will be no judgment here. This is about understanding your body and adapting when necessary. Before we begin, remember that this video is educational and doesn't replace personalized medical advice. If you're experiencing persistent pain or unusual symptoms, speak with your healthcare professional. Mistake number 1 is not using enough lubrication or choosing the wrong kind. This becomes increasingly important after 60 because aging can bring changes to the skin. Tissue may become drier and more sensitive to repeated friction than it was when you were younger. Without enough lubrication, repetitive movement can cause irritation, redness, soreness, or tiny injuries to the skin. You may not notice the problem immediately, but continuing despite discomfort can make irritation worse. The safer alternative is simple. Use adequate lubrication from the beginning and add more whenever needed. Water-based lubricants are popular because they're generally easy to clean and can be used with latex condoms. Silicone-based lubricants usually remain slippery longer, which can be useful when additional lubrication is needed. However, silicone lubricants may not be compatible with some silicone toys. And there's another important rule. Avoid oil-based lubricants when using latex condoms, because oils can weaken latex and increase the chance of condom breakage. Whatever option you choose, lubrication shouldn't be treated as something unnecessary or embarrassing. Its purpose is to reduce friction and make the experience more comfortable. Most importantly, pay attention to what your body is telling you. If the skin starts burning, becoming sore, or feeling irritated, don't simply continue through the discomfort. After 60, protecting sensitive tissue matters more than maintaining an old routine. Mistake number 2 is using excessive force or an aggressive technique. This is especially important for men over 60 because some habits developed when you were younger may no longer work comfortably as your body changes. When sensitivity seems reduced, the natural reaction may be to grip harder, move faster, or apply more pressure in an attempt to create stronger stimulation. But that approach can become counterproductive. Excessive friction or pressure may leave the skin irritated, cause bruising, temporary numbness, soreness, or simply make the experience uncomfortable. Instead of increasing force, change your approach. Slow down and focus more on sensation, comfort, and rhythm. A lighter grip combined with adequate lubrication may provide a more comfortable experience than repetitive hard movements. You can vary the pace, introduce pauses, and give your body more time to respond rather than trying to force an erection or orgasm. Remember, this isn't a performance test. There is no prize for finishing quickly or using maximum pressure. Most importantly, listen carefully to your body's signals. Pain, persistent tingling, numbness, or unusual discomfort are reasons to stop, not sensations you should push through. Your goal should be pleasure, without unnecessary strain. As your body changes, your technique may need to change with it. Mistake number 3 is neglecting hygiene after ejaculation. It sounds simple, but it can make a real difference in comfort, particularly for older men. After masturbation, small amounts of semen, sweat, and moisture can remain on the skin, beneath the foreskin in uncircumcised men, or around nearby skin folds. When that moisture stays there for long periods, the area can become irritated and create conditions where microorganisms grow more easily. Men who already have conditions such as diabetes may need to pay even closer attention to genital hygiene because infections and skin problems can sometimes become more troublesome. Fortunately, the safer approach is straightforward. After ejaculation, gently clean the area using warm water. If you use a cleanser, choose something mild and fragrance-free rather than a strongly scented product. There's no need to scrub aggressively. Gentle washing is enough. If you're uncircumcised, carefully retract the foreskin, clean underneath, rinse properly, and return the foreskin to its normal position afterward. Then dry the area thoroughly, but gently. Don't leave excess moisture trapped against the skin. And avoid trying to make yourself extra clean with alcohol-based wipes, harsh soaps, perfumes, or strongly scented products. Those can irritate sensitive tissue rather than protect it. Good hygiene doesn't need to be complicated. It's simply another part of taking care of your body. And when you combine proper lubrication, gentler technique, and good hygiene, you're addressing all three mistakes together. But why do these seemingly small changes become so important after 60? That's what we need to discuss next. Now, why do these three mistakes matter so much after 60? Because we're not simply talking about avoiding temporary irritation. We're talking about protecting the comfort, sensitivity, and function of your intimate tissues as you continue to age. Think about the three mistakes together. Too little lubrication increases friction. Excessive force adds unnecessary strain. Poor hygiene can leave the skin irritated and uncomfortable. When these habits are repeated, something that should feel pleasurable can gradually become associated with soreness, anxiety, or frustration. The solution isn't to stop masturbating simply because you're older. The better approach is to adapt the way you do it. Use enough lubrication to keep friction comfortable. Be gentler and allow your body more time to respond. And afterward, clean and dry yourself properly without using harsh products. These are small adjustments, but they can make masturbation more comfortable and sustainable. There's also an emotional benefit to changing your approach. When you stop treating masturbation like something that must happen quickly or exactly the way it did decades ago, you remove unnecessary pressure from yourself. Your body is allowed to change. Maybe erections take longer. Maybe sensitivity feels different. Maybe you need more stimulation on some days and less on others. None of that automatically means something is wrong. The important thing is learning to listen to your body instead of fighting against it. And there are several signals your body may give you that should never simply be ignored. We'll talk about those next. Now let's talk about the signals you should never ignore. Masturbation itself should not routinely leave you with persistent pain, bleeding, significant numbness, unusual discharge, swelling, or ongoing irritation. If any of these appear and don't resolve, don't simply assume they're a normal consequence of getting older. The same applies to noticeable changes in erectile function. Having an occasional difficulty is common, especially when you're tired, stressed, anxious, or taking certain medications. But if erections become consistently difficult to achieve or maintain, particularly when the change is new, it's worth discussing with your doctor or urologist. Remember, sexual function is connected to many different parts of your health. Your blood vessels, nerves, hormones, medications, emotional state, and underlying medical conditions can all influence how your body responds. That's why repeatedly increasing pressure during masturbation isn't the answer when sensitivity or erections begin changing. Another important principle is frequency. There isn't one masturbation schedule that every man over 60 needs to follow. Some men may masturbate frequently, others occasionally, and some not at all. What matters is how the behavior affects your body and your life. If masturbation isn't causing injury, interfering with responsibilities, disrupting your relationships, or becoming difficult to control, frequency alone isn't necessarily the problem. Instead of asking, how often should a man my age masturbate? Ask a better question. Is what I'm doing comfortable, healthy, and working for my body? Gentlemen, let me leave you with one final message. Masturbation is not something you automatically need to abandon simply because you've reached 60 or beyond. What matters is understanding that your body changes with age and allowing your habits to change with it. The 3 mistakes we've discussed are straightforward: masturbating without adequate lubrication, using excessive force, and neglecting hygiene afterward. Avoiding these mistakes can help reduce unnecessary irritation and discomfort while allowing you to approach your sexual health with greater awareness. I'm Dr. Leah, and I want you to remember that getting older doesn't mean becoming disconnected from your sexuality. It means paying closer attention to what your body needs today. If you experience persistent pain, bleeding, unusual discharge, significant changes in sensitivity, or ongoing erectile difficulties, don't suffer quietly or try to solve everything by changing your masturbation technique. Talk with your doctor or urologist. Getting evaluated early is always better than allowing embarrassment to delay care. Most importantly, leave shame out of the conversation. Knowledge gives you the ability to make safer decisions and recognize when something deserves attention. If you found today's discussion valuable, like this video, subscribe, and turn on notifications so you don't miss our upcoming men's health conversations. And tell me in the comments, which of these 3 mistakes surprised you the most? In our next discussion, we'll address another question many older men quietly wonder about: low libido after 60. Is it normal? What can cause it? And what can you do about it? Until then, take care of yourself. Stay informed and stay connected to your health.